Welcome One-on-One. I'm Steve Adubato. This particular program, this segment, is part of our ongoing series on, quote, the future of healthcare in New Jersey and the nation. We're thrilled to be joined by our good friend, Mike Maron, President and CEO, Holy Name Medical Center. Mike, I hold you responsible. I was in your office. We're having a conversation. We're talking about healthcare and how much we do. And you said, you know, why don't we do a sustained, ongoing effort? And I thought, we do so much healthcare, medical, clinical programming.
Yeah.
This is part of a broader discussion. Why is that important?
Well, it's important because healthcare is going through some real dynamic changes, transformation. It's complex. It affects everybody. And you can't repeat it enough with the changes that are going on, right? So they're happening slowly, making this a hot topic at every level, how it's paid, how it's delivered, how it's transforming. To me, ultimately critical. You can't talk about it enough.
The Catholic piece, Catholic hospitals.
Yeah. So Catholic healthcare.
Talk about changing.
Changing, yeah. Well, you look at everything that's going on, Catholic healthcare is changing.
In New Jersey and the nation.
And the nation. When I was in New Jersey, when I first came to New Jersey 31 years ago, I've been at Holy Name, there were 16 Catholic hospitals in the state. Today, we're down to 4. It is highly probable, given other discussions that are going on, that by the end of 2019, Holy Name is alone.
What does that mean?
Well,
and what are the implications is the larger question.
Because at the end of the day, with all this transformation, personalized care, we talk about population health, we talk about culturally sensitive healthcare delivery. At the end of the day, what does it all mean? In the Catholic Church, in Christianity, Judeo-Christianity, frankly, I just gave this talk in a sukkah the other day. So there are 2 rules, ultimately, that on everything all stands, right? And that is, love the Lord thy God above all else, with all your heart and all your mind and all your soul, and love your neighbor as yourself. We say those words, we kind of dismiss them a little bit. A lot of people challenge whether God exists or not. A lot of people challenge whether why should I love my neighbor? But if you take those, and on those 2 rules, all else stand, and you apply it, you don't just talk about it, you live it.
But Mike, you're not saying if a hospital is a non-Catholic hospital and that they couldn't have the same commitment. Do you think yours is different?
No, yeah, it is different, because at the end of the day, Steve, this is what's going on. The pressures that exist on all my colleagues, and I don't diminish them.
Largely economic?
Their motive, their number one is, I have to make a margin. Even if you're tax exempt, it doesn't matter. You still have to make a margin, right? The difference is, in a tax exempt organization, margin gets reinvested back into the community. In a for-profit, margin is extracted out. Right, so I'm not a big fan of for-profit medicine, because the money in a very fragile system gets extracted out. What's different between us and them, margin doesn't always drive what we do. And so
That's why you're in Haiti.
It's why we're in Haiti.
We should tell folks it's about the 4th year we've been doing programming with Mike. Sorry for cutting you off, Mike.
That's right.
I was calling Mike, texting him the other day. He was just coming back from Haiti, another trip, building a hospital there. Why? Because it's bottom line profit?
No, there's no profit in Haiti. It's a drain on us, right? But at the end of the day, what happens? When I go to Haiti, and we now operate a 200-bed hospital.
That's Hospital
Sacré-Cœur, right? In Milo, it's in the north, just outside of Cap-Haïtien. What happens there is all my staff, who it's totally voluntary, no one is obligated to go, but I have tons of my own staff that volunteer to go down. We have thousands of healthcare practitioners across the country who volunteer to come down.
What impact does it have? Has it had?
We educate the Haitians how to take care of themselves. But the profound impact that experience has when you come back here and you want to complain on any given day because something's not working or things didn't go quite right, and you put it in the perspective of the challenges that face the people in Haiti, and when you witness that firsthand, you come back, you're a better practitioner. You're now hypersensitized to the fact that I'm blessed and I need to help you as best I can, and I shouldn't really be complaining, because it's not that bad.
By the way, if you go on the Holy Name website, you can find out more about the Haiti initiative, which we've been following for many years now. There's another project. We were talking offline, and you were telling me about a young man, I think his name Adam Jetto, is it?
Yes, yeah, Adam. Yep.
Who works at Holy Name, but is part of a larger initiative that is pretty significant.
Right.
What is it?
So again, this is a Project Search.
Project Search.
Project Search. It is a Bergen County special needs educational initiative launched by County Executive Jim Tedesco and Tracy Zora, the freeholders. Terry Molinari is part of this, and what they do is they take young educationally challenged individuals, put them through special education programs, but try to get them in the workforce so as they age out of high school, they have some self-dependency. They're not completely just dependent on their families or society as a whole. So Holy Name partnered with them to allow these students to come through and get work experience, and then ultimately, if they work out, we hire them, or they can find a job with that skill set. That is Adam. Adam is one of many. Adam is a dynamic, great young guy, wants to be a chef. We put him in our food service department. He bounced around to different jobs. His energy level, his focus, his enthusiasm for what he do is contagious. And he comes to work every day as positive as anybody I ever saw. And this is the same as Haiti. It's the same as everything we do. These are small examples.
They're not one-offs.
They're not one-offs. We don't do it just with Project Search. We're very proud of our participation there. We do it with Sinai schools. So Sinai schools, same type of program in the Orthodox Jewish community. Tremendous educational program for developmentally challenged children. And then the same thing, get them into the workforce. And so Holy Name's partner with them.
You see it as part of a Christian/Catholic philosophy?
Absolutely.
So, one more thing, separate from this. Public policy part of this, future of healthcare.
Yep.
I remember you saying to me, we need more transparency.
Yeah.
There's not enough transparency between patients, family members of patients, and healthcare organizations as to what is being done and how much it costs. Why is that part of the, quote, the future of healthcare?
Because at the end of the day...
Don't we have all this technology?
Yeah, sure.
So shouldn't that information be more accessible?
The information exists. It's not accessible because lack of technology or lack of the information being there. It's policy. And we need to change those policies.
Be specific.
So if we want to drive down the ultimate cost, if we want to curb the escalating costs, right? Healthcare.
Of healthcare. We all say we do.
Yeah. Healthcare is projected to reach 20% of this nation's GDP spend.
20.
Healthcare, 20. That's unprecedented anywhere on the planet, right? There's a lot of good in there. There's a lot of waste in there. And what we know for a fact, and there's an absence of innovation, when pricing and quality both are equally transparent, only then can you have true value-based care.
Sorry for interrupting, Mike. Why are so many costs appear to be hidden for some of us? We can't figure out what they're for.
Because it's the nature of how the business has evolved over the last 40, 50 years.
Well, can the legislature change that?
Absolutely.
And say what?
Say that now through the Department of Banking and Insurance, through the Department of Health, we want to have a pricing consistency and transparency that all providers and all payers need to comply with. Rates need to be, we hide behind this veil of antitrust, right? It doesn't, we got mergers happening all over the place.
But I can't show you my information because if I show you my information,
yeah.
Are you
Because if I show you my information and you realize the pricing disparity that exists, then you may make a choice that is not in my best interest today, right? As the provider.
What about for the patient?
Yeah, well, exactly. And that's what Holy Name's all about. It's the patient, right? We're here for the patient.
Mike, I ask you to continue being a participant in forums on Caucus, New Jersey, on public policy programs, on state of affairs, here on One-on-One, around the future of healthcare in our state and clearly in our nation. I want to thank the Commissioner of Health for participating in that discussion, Senator Joseph Vitale, the chair of the Senate Health Committee in the state legislature, and so many others. Thank you, Mike.
Yeah. Thank you. Thank you for
doing
having me.
what you're doing.
And those are all great guys. They're committed. They want to try to move things better. It is complex. Right?
We'll stay on it.
We got to stay on it.
That's our job. Thank you, Mike. Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Fedway Associates, Kessler Foundation, Georgian Court University, the Healthcare Foundation of New Jersey, Summit Medical Group, New Jersey Resources, and by the Fidelco Group. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.